or like soft spots that we should be worried about, and then we'll go into more of the senses, some sight, some smelling, hearing, things like that. It's a simple process, so don't be nervous. The thing that people get most confused with is the words at the end. I will ask you to repeat some words back to me. Sometimes they kind of mess up on that. We get distracted, but other than that, it is a simple process. So let's do the paperwork first. So I have your name here, have your address, phone number, where you're going to work, all that stuff. So is there any medication you're on currently? Okay. And how many times a day you take that? Okay. Anything else? Some melatonin at night. That's not really a medication, but I'll write it down because it could make you drowsy throughout the day if you don't get enough sleep. Okay, have you had any problems with memory loss, falling, fatigue, passing out, anything like that in the past? Okay. Have you or your family had any of these experiences? Anything that runs in the family that you know of? Okay, and that's on your dad's side. Alright. It looks like that's all the information I need from you, since this is just a checkup for a job and you're not actually suffering anything right now. Okay, so let me go over these words. I'm going to ask you these, and then I might ask you some at the end of the checkup. Just try to remember as best as you can. They'll all be kind of related with something. So the first words I want you to remember and repeat back to me. Let's see, we have coconut, banana, orange, apple, and pear. Now, can you repeat those back to me? Perfect. Awesome, you're doing great. Now, this one will be some animals. Let me know if you can repeat this back to me. We have alligator. We have jaguar. Cheetah. Lion. Monkey. An elephant. Can you repeat that back to me? Perfect. You're doing great. Now this one will be some numbers. 15, 7, 3, 22, and 9. Repeat those back to me, please. Awesome. Alright, that part is done. Now, if you can, keep some of those in your mind because I may ask you at the end. But your memory for that is fantastic. I had to look to make sure I was saying them right on the paper. And I do this all day long. Okay, so the next thing I want to do is get some gloves on. These plastic gloves right here. Yeah, they're a pain in the butt to wear, but you know, for sanitary reasons we have to wear them. So let me get these gloves on. Get them down in each finger. Alright. Now next I have just this little tape measure. I'm just gonna measure your head. Let's get it around you right here. Perfect. Now this way. Perfect. Now this way. Alright. the 65 percentile with a head measurement, so that is totally normal. Now, if you don't mind, I'll just feel around your face, your head. Alright. Alright, do you feel all of this? Just a little tapping on you. Perfect. How about that? Just a little pressure. Perfect. Alright, I don't feel any lumps, soft spots, or anything like that. So you check off perfect for that. So everything so far, so good. Now, next I want you to close your eyes and tell me if you hear this. Are you ready? Good. 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 Okay. 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 Awesome. Now tell me how many taps you hear. 3. Okay, good. Okay, good. Awesome. Good. All right. All checks out, so it looks like your hearing is perfect. Now, I have these little valves right here. I'm gonna shake them up. They're gonna smell like different fruits. You just tell me what they smell like, okay? Awesome. All right, first one. All right, it's activated. Now tell me, what do you think that is? Perfect, strawberries. All right, we have 3 of them, so the next one is here. All right, what we got here? Yes, it is a citrus smell. Orange, perfect. You are knocking this out the park. We got one more. This is a tough one. I don't think I would get this one. Close, close. You said raisin. It's a grape, but I mean, I guess it's kind of the same thing, so I'll check you off as. Put a little side note here. Yeah, I would never have gotten grape. Okay. Now the next thing we have is your sight. Alright, are you ready for this? I'm just going to ask you to tell me when I'm moving my fingers, and then we'll see line of sight, okay? So we have good, 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 good. Now tell me what side is coming towards you. Good, 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 good. Awesome. Now I need you to follow this light. Alright, are you ready? Okay. Awesome. Now tell me when my fingers are out of line of sight. Good. 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 You knocked this out the park. So we checked if you could feel your hearing, your eyes. We I'm going to sign you off right here and you'll be good to go. Yeah, everything looks perfect. I'm so happy that you chose us to do this cranial nerve exam with. From my personal, experience, you're gonna pass the other physicals if you haven't done them already. You look like you're in great shape. You look like your memory's there. And congratulations on the new job. Yes, it was a pleasure meeting you, and it was a pleasure getting to do this cranial nerve exam. You have a good one.